Hi there, welcome to the best and worst lists. Today, we'll talk about the most interesting symptoms of the coronavirus in the world, about the COVID-19 pandemic, which is unfortunately the biggest problem of our daily life. It's known that 80% of patients with coronavirus show mild and moderate symptoms. In some cases, those exposed to coronavirus can survive the disease without showing any symptoms, so asymptomatic. 1 in 5 of the COVID-19 patients develop serious symptoms including shortness of breath, high fever that does not go away for a long time, chest pain, and bruises on the face and lips. For patients with severe COVID-19, the situation progresses to fatal lung damage and pneumonia. Experts say age and the underlying chronic disease factor play an important role in severe cases. On the other hand, the vast majority of more than 33 million patients worldwide who have got COVID-19 have mild symptoms. In addition to the common and less common symptoms of COVID-19 symptoms, some unusual symptoms have been observed in recent days. Most common symptoms among COVID-19 patients: weakness, fever, dry cough. Less common symptoms that occur in some situations: muscle pain, nasal congestion, headache or dizziness, sore throat, diarrhea and nausea, chills, loss of smell and taste, stomach and intestinal problems. Uncommon symptoms in COVID-19 patients: COVID finger. Redness and rashes were found on the fingers of COVID-19 patients in many countries. Moreover, in most cases, it was observed that these rashes were not accompanied by other common symptoms. It was found that the rashes could be in the form of red or purple lesions and appeared on the side or sole of the foot and even on the hands. Conjunctivitis or red eye. Conjunctivitis, a rare symptom of COVID-19, was caused by the appearance of the viral particles in tears. According to experts, any upper respiratory tract infection can result in viral conjunctivitis, and this also applies to COVID-19. Skin spots and tissue damage. According to a study published in the British Journal of Dermatology, 6% of 375 COVID-19 cases examined had tissue death and discoloration due to insufficient blood flow on their skin. In this study, it was noted that this symptom was seen in more severe cases. For example, in the city of Wuhan, where the COVID-19 pandemic occurred in China, the doctor Hu Weifeng died after his skin color changed after he was caught in the coronavirus. Cardiologist who stated that he got coronavirus on January 18 and recovered after 2 months of intensive treatment. Yifan and urologist Dr. Hu Weifeng's skin color was observed to change later. Chinese experts linked the skin color change in the two doctors to damage delivered by the virus. Chinese experts linked the skin color change in the two doctors to damage delivered by the virus. Got the virus and then treated. Dr. Hu Weifeng told the Chinese media, "When I regained consciousness and learned about my health, I was scared. I often had nightmares." Tingling sensation. The director of the Infection Prevention and Control Department at Mount Sinai Hospital in New York stated that some COVID-19 patients complained of tingling and burning sensations. Director Dr. Walid Javed said that such sensations may be an effect of the patient's immune system against COVID-19 rather than an effect of the virus itself. Day by day, we are changing and experiencing our knowledge about the coronavirus. We hope a permanent solution will be found as soon as possible and the world will get rid of this pandemic. I am sure that people have learned a lot from this pandemic. We wish mercy on all the people who lost their lives due to this pandemic, and we are grateful to the heroic health workers who could not even go home for us. Please, put on the mask, keep your social distance, wash your hands, and stay home. If you want such videos to continue, please subscribe the channel, like the video, and turn on the notifications.